Tuesday, topic Tuesday. This article was written by our fourth year medical student, Duke, who is either no longer a medical student and going and he's in his residency. I really got to check on that. Or this is his fourth year. This might be his fourth year right now. Either way, him and Adam are killing it on their Topic Tuesday blogs that they put together. It's just so easy to understand the information when they write it. But what they were talking about last week was aortic valve replacement, or actually surgical aortic valve replacement, or SAVAR, I guess would be the way that you would pronounce that acronym. And to be honest, I've never heard of that before, versus transcatheter aortic valve replacement, or TAVR, which I have heard. So let's talk about aortic valve and valve disease. So the aortic valve, which we had talked about in the prior week, is the valve that functions as the door between the heart and the aorta. So it's got typically three leaflets or three cusps, and sometimes people have two. So that would be a bicuspid aortic valve. But when the valve is damaged or not functioning well, the condition is called aortic valve disease. And when aortic valve disease is mild, there may be no symptoms at all. But as time passes, and the condition could get worse, so the heart has to work harder against the valve and can damage the heart, which I did not even know that part. So when this occurs, symptoms such as chest pain or difficulty breathing, that might actually develop. And two common forms of aortic valve disease exist, and that would be aortic stenosis, which we have talked about, and aortic regurgitation. So let's review this just a little bit. So in aortic stenosis, the aortic valve has trouble opening due to a narrowing or thickened valve, and it doesn't really open up enough for blood to flow from the heart to the aorta each time the heart beats, because it's gotten too thick. And in regurgitation, aortic regurgitation, the aortic valve might not be closing enough or properly, which causes blood to actually leak backwards into the heart instead of going to the aorta with each heartbeat. So instead of going forward, it's going backwards, hence it's regurgitating back into the heart. So what is surgical aortic valve replacement and transcatheter aortic valve replacement? So surgical is when there's open surgery, hence the name, and this would be open surgery for the aortic valve, and it can either treat stenosis or regurgitation, and this requires an incision or cut in your chest and then in your chest bone to actually access the heart. So a key consideration when deciding if you're going to undergo SAVAR versus TAVR is determining when you're going to replace that valve, do you want to receive a biological valve that's made from a pig or a cow heart tissue? Or do you want a mechanical valve? And that's made of carbon and steel. And that will require lifelong blood thinning medications called warfarin or Coumadin. And that helps reduce the risk of blood clots, as blood clots are more likely to form with a mechanical valve. So each valve has its own pros and cons. And the surgeon can talk about which valve is recommended based on factors such as your age and your lifestyle. I have heard that the younger you are, you probably could go with a tissue valve because they are going to have to be replaced. Usually they say 10 to 15 years, whereas mechanical supposedly lasts the rest of your life. I think it's a very personal choice, and it's something that you really have to think about. I know that I have heard that mechanical valves in the past could be considered quite loud. People hear this tick-tocking versus a tissue valve. You don't really hear anything. And no, you do not need to take any kind of anti-rejection medication when you have a tissue valve. So if you're wondering about that, you don't. But you do need blood thinning medication if you have the mechanical valve. And so those are two considerations when making your decisions. And there's a lot of information out there about these different valve choices. And again, very personal for yourself, your family, and especially between you and your physician in finding out which one you think might work better for you. Now, these are all when it comes to elective surgeries, because when you have an emergency, and which typically these valves get replaced if you have a dissection, you don't really get a choice. It's not like anybody's going to lean over and be like, hey, have you given any thought? Which one do you want? I got door A is mechanical, door B is tissue. They're not going to ask you. They're just going to give you what their best judgment would be for you to have. So something to think about. Now, with a transcatheter aortic valve replacement, or TAVR, which you might hear in the community, It's minimally invasive approach. That already sounds really good to me. But that can be used, this minimally invasive approach can be used to treat aortic stenosis. That's what it's used for, basically. And below, I'm going to show you a diagram that illustrates how TAVR balloon is placed at the site of the thickened and narrowed aortic valve and then expanded open to treat aortic stenosis. And during a TAVR, a doctor will actually guide a catheter using X-ray and imaging guidance to replace the damaged aortic valve with a biological valve. Okay, so here's your picture. Here's your stenosis, all of the little calcifications and the hardening and the narrowing and all of that that's happening right here. This is that valve. Okay, and this is what they're using. This catheter goes in down below at your groin typically and comes all the way up the aorta and comes right here into the valve. And they use this balloon to deploy. This is the actual valve, the replacement valve. Okay. Now, compared to a surgical valve replacement, a transcatheter aortic valve replacement uses much smaller incisions, often at the site of the groin, for a tube-like catheter that can be directed through the blood vessels to the site of the aortic valve. It's crazy when you think about it, that it's going all the way up and then back down. And so for any of you who have had an angiogram, I've had one of those. It's and I don't know if the procedures are handled differently, if you're more asleep. I know I was given a sedative, but I kept waking up and asking to watch, and then I'd fall back to sleep. So it wasn't anything that I felt that was painful, but I did feel pain and some pressure at the site of when they punctured to get it into the groin. But you don't feel anything else afterwards. I didn't feel anything else. But so it's directed through these blood vessels, to the aortic valve rather than a open large incision at the chest bone, which is known as a sternotomy, which is required for a surgical aortic valve replacement. So a TAVR as an option is for people who can't have heart surgery. Which would be the SAVR, to replace the aortic valve. So for a surgical replacement, there are options for smaller incisions known as a partial sternotomy or by right anterior thoracotomy. Such big words. I can't believe I'm saying them right. However, since a TAVR is actually just less invasive, the length of hospital stay is much shorter than the post-operative hospital stay you would have with a surgical aortic valve replacement. So if you think or have known that you have aortic valve disease, discuss all of this and with your concerns and questions. Talk about it with your surgeon, because there are different surgical techniques and then there are different valve options. And this is by no means a comprehensive post or description. This is just meant as a starting conversation point that you might want to have with a physician and kind of giving you some familiarity with acronyms and some terms. So now you've been educated basically on what the SAVR, I'm just going to say that that's how it's pronounced, the SAVR or surgical aortic valve replacement kind of does. And it is a much more involved surgery because it's an open sternotomy, right? For those of us who have had a dissection, we already know we've had those chest bones cut open, versus a TAVR, which is a thoracic aortic valve or transcatheter aortic valve replacement. So two different techniques, many different, choices between valves, lots of things to consider. Great introduction from Duke. We appreciate this. This really will help people kind of seem like they understand a little bit more as they're having these discussions with their physicians. So that was our topic Tuesday.